We have a tremendous problem with individuals that need help.
Data, statistics, just looking at the news will tell you something is very broken. Opioid use disorder, substance use disorder, those numbers are absolutely through the roof.
People really genuinely want things to be better, but a lot of people don't understand behavioral health.
There's a lot of fear, a lot of guilt, a lack of understanding what behavioral health is.
These aren't moral failings. These aren't people like who chooses to have a mental health disease, who chooses to have a substance use disorder. Nobody chooses to be homeless.
We're at roughly 225,000 unhoused Californians.
There's a need everywhere. If you have a waiting list and there's people trying to get in a drug treatment facility, there's a whole bunch of people not getting in there.
We would be up in arms if it was someone with a heart attack who arrived at the emergency room and they told them, sorry, we can't serve you today because we don't have the capacity.
And if we have the power to do something to help our community and to help those that are suffering, why not do it?
This is historic. There's never been an opportunity like this to build capacity in this kind of way.
Goals for this epic level of investment is access to care.
The communities that need mental health care, behavioral health care the most are the marginalized, hard to reach communities. It can be our inner city, low income communities. It can be rural communities.
We want to reach out to as many people as we can and say, look, this is not an isolated issue. This is an issue that affects every single one of us.
Well, it's important that our community have access to care because without having access to care, you can't really improve your life.
I used to come here for hope. I was hoping to see a person that can speak to me spiritually, culturally, and about our heritage. I found it here. This is a blessing to me, and I'm sure to many others.
That's really the mission. The mission is to see this organization be the light of the Native American community, be that beacon where they can see it from afar and come and say, hey, I need help. And whatever it is they need, we're gonna make sure they get it.
So one of the things that CRI-Help is known for is serving individuals from diverse socioeconomic backgrounds. As of last year, 95% of the persons that we admitted into treatment were Medi-Cal eligible beneficiaries, and we'll look to extend that reach here in Lincoln Heights. From the time that you pick up a phone and you talk to a receptionist, to meeting with an intake counselor, meeting with a primary counselor, working with your therapist, all the way up to the medical director. We seek to employ persons who are Spanish speakers, and we believe that the infrastructure that we're looking to launch in the Lincoln Heights neighborhood will be something that is culturally responsive and can provide services to adults who are monolingual Spanish speakers.
ABC has what we call a full continuum of care, which means that we can take somebody in at the detox level. We have a psychiatrist for a medical director, so we can pay attention to their mental health disorders as well. And then we can transition them and slowly disband the structure down to the outpatient level of care, and we even provide housing.
The benefit of our programs is it saves families, it mends families, it brings them back together. People are living a healthy, fruitful life. So I think in all aspects it benefits even people that don't have addiction.
That's a lot of recovery and a lot of human beings that are getting treatment they couldn't get before.
I can't stress enough. So facilities of our type would never be able to afford to build a project of that scope. It's unprecedented and it's historic. The help that our communities are going to receive is going to multiply, drastically over the next couple of years.
Trans, gender, and conforming intersex people need to have access to care. And that is one of the reasons why we exist as an organization, so that we can not just advocate, but also, in some ways support and provide the care that our community needs.
The TGI community that is homeless is out in the Hollywood and West Hollywood areas. So for us, that is our epicenter. That is where the need is at.
I've never seen a grant this significant. You intentionally and meaningfully invest in the livelihood of people, then that's how you create the change, right? And make the difference that needs to happen in people's lives.
These are things that are going to be truly lasting. And so when the day is done, there'll actually be these physical structures that build out that access. Even though it's a tremendous amount of change we're taking on in California, that once we actually arrive and get there, it's going to be phenomenal. And then I want to be a model for other states and help them get there as well, because I don't just care about people here in California, I care about anybody that has this disease.
For myself, treatment on demand was essential. It saved my life, and it has saved millions of lives across the United States.
I think we often hear about the issues, but we don't hear about the success enough. Anytime we expand more resources for people that are marginalized and disenfranchised for the community, we're bringing hope to the community.
and remember we're doing this to save lives.